Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, KHTS. And our guest now is Mike Dougherty. He is the Community Relations Representative, Behavioral Health. Whoa.
Over at Henry Mayo, Newhall Hospital.
That's right. I forgot it. It's on my paper, but I was reading your card. You shouldn't have given me your card. Got me all confused.
Miles and I were just comparing notes before the show started. We said it seems like he and I come on the show. He's on one half and I'm on the other, and then
it's funny in the community we're all together.
Yeah.
You know, working toward different aspects at the senior center, at College of the Canyons, and you know, we just it's not a clique or anything. It just so happens our interests are based in seniors and assuring that their quality of life moves forward.
Yeah.
So we were going to talk about what seniors need to know.
What seniors need to know about their mental health. You know, I told you last time I was here that I was going to be at the SCV, the Santa Clarita Valley Senior Center. And I was there last Wednesday. In fact, I saw Dr. Dorio there when I showed up, and Robin and Suzanne Nelson. Hello to everybody over there. What a great group of folks. We had a full room. They were very interested in hearing about senior mental health. And by the way, I'm going to be a shout out to Canterbury Village. I'm going to be there next week, July 27th, from 11 to 12 at Canterbury Village.
Now, where's Canterbury
Village?
That's
a senior housing complex over kind of behind where Kentucky Fried Chicken.
Well, Vallarta, there's a market there called Vallarta on Lyons Avenue, and right behind there in the community, there's a
that's Canterbury Village,
3-story, 4-story building that
great group.
It's a senior facility. It's really neat. But one of the many aspects of mental health that our seniors face is depression, and you know, one of the problems that many people won't admit to, especially senior guys, is that they're suffering, and they suffer in quiet. And I think you brought some statistics out about senior suicide, and you know, that's something we just don't talk about. It's not swept under the rug. But it's just something I don't think we have yet in this community been challenged with. And you know, one of the things I think we need to bring forward is that, you know, it's a staggering number.
Oh, it sure is.
Yeah, and I think you brought this up at the meeting.
I did, and two things. What you're talking about. Number one, yes, they're quiet about it when they start feeling depressed. 65% of seniors believe that depression is a normal part of aging. And that's sad because it isn't. Depression is not normal at any age, and you have to have it treated, because depression, untreated, can lead to suicide, can and does. That's why the behavioral health unit is there at Henry Mayo, because, you know, primarily we have a lot of people coming in for depression, and they're wanting to take their own lives. Then we also have people who are sometimes homicidal. And then people who are what's known as gravely disabled, and they just can't get through the day without any help. But we deal with people from 18 years of age on up, and we've had plenty of people on our unit up into their 80s who were there because they were feeling suicidal and they needed some help through that. And they can get the help they need. That's the important thing. But the other thing you were talking about, Dr. Dorio, and I brought this up at the Santa Clarita Valley Senior Center, and again, we had a room full. We were packed with seniors, and I asked them what age group had the highest rate of suicides. And most of them were thinking what most people think, and that is college-age students, right? There's a lot of stress in college and all of that, but that's absolutely incorrect. When I told them what the age group was, there were literally gasps in the room. People were just so shocked by this. But those 85 years of age and older have the highest rate of suicide. And those aged 75 to 84 have the second highest rate of suicide. And here's another thing that I don't think we've talked about on this program before, but this is also true. Did you know that seniors, when they go to commit suicide, are more successful than younger people? Younger people sometimes will go 20 tries, and of course we all know a lot of that's a cry for help. But when it comes to seniors, 4 times. Is the most.
Why is that?
Because they're set. They're ready to do it.
They're ready to go.
We're not fooling around.
Younger, they think, maybe I still have, you know, some adjustments in life that I can deal with, and maybe this isn't the right thing. But with seniors, they'll say, I've lived a great life and this is it. I've lost my loved one and my health is not good, and I'm just not going to go through this anymore. I'm not going to deal with it.
They literally get tired of dealing with the problems. And Dr. Dorio and Barbara, we've talked about this also before, but the worst group within the seniors are white males.
Mm-hmm. Yep.
Yeah.
They really come to the end quickly and say that's it. And most of them, when they go to try to end their life, they do so drastically that they normally don't mess it up.
So how do we recognize across the board, how do we recognize those seniors who not only have depression but might be tilting toward the edge where they're starting to have not just the idea, but they're getting things planned, and you can kind of tell. But how do we recognize that in our patients and in our neighbors and the people around us?
Well, there are some subtle signs and there are some not so subtle signs. The subtle signs would be somebody that's experiencing sadness that's lasting more than 2 weeks, because we all get down. We all get, we have bad days and we can be sad for whatever reason or just down, but that's just a passing blue mood. And after 2 weeks, that should kind of be gone. And if it isn't, then you may be looking at clinical depression, which they can't get over without help. Consistent worries about issues such as money, family, friends, it just won't go away. Consistent trouble sleeping and concentrating, where it's noticeable, and frequent trouble remembering things and feeling confused in familiar places. These are all situations where you need to seek a professional, find out what's going on. But some of the more obvious signs that, even though they're obvious, we may not pick it up because we hear these things throughout our day and we don't think much about them. But if somebody says to you in conversation, I think you'd be better off without me, that's pretty darn serious. That's not something that you should just say,
keywords.
Oh, fudge, that's come on, get over it. That's not true, you know it. If somebody says that to you, there's something going on in their mind, and it's profound. And if they start giving away things, especially things that are precious, if they've got something that's a precious possession of theirs, and they say, I'd like you to have this, that's something you need to think about.
And other things that you might recognize that I look at is weight. Sometimes they're losing weight. Their clothes is not fitting like it was in the past, and they're disheveled. They just don't comb their hair. They don't shave. They don't keep their looks up. And hygiene, all of that.
Stop showering.
And so that recognition, if you see that in friends around you, your neighbors or your loved ones, look real carefully. Look a little deeper, because I'll tell you, that could be a sign that something is going on that's more profound than we think.
And here's something that I don't think I've brought up here before, but this is very interesting. Mental health problems are a risk for older adults regardless of their history. In other words, while some adults may go through life managing a chronic mental illness, mental health problems, just like physical issues, can appear later in life. So sometimes mental health deteriorates in response to things like a stroke or Parkinson's disease, cancer, arthritis, or diabetes, or even some medications. Now, we're out there watching television and you hear may cause depression.
That's right.
So that can happen. And older adults without a history of substance abuse may start abusing medications, alcohol, or drugs, because what happens when they start feeling depressed, they self-medicate. And so all of a sudden, you've got another problem. Now, I can tell you in the behavioral health unit at Henry Mayo Newhall Hospital, we have probably over half of our patients have a substance abuse problem on top of mental health.
Yeah.
Wow.
Exactly.
Because of self-medication. So they get themselves in trouble with drugs or alcohol, or they're abusing their medications. That's very common.
And then when they're in the hospital, they cannot abuse them.
No.
And they get very agitated
That
and
happens.
upset. Yes.
It sure does.
Yes.
People withdrawing from heroin and things like that is not a pleasant sight.
No.
And it's tough. But, they've got to do it, and we're there to help them. That's what it's all about. But, continuing to self-medicate like that will only get you deeper and deeper into trouble. It's not going to help.
No, it's not. Absolutely will not.
Remember also that as we look at individuals, look also at couples. because you see a husband and wife, they've been married for 50 years, and they're holding hands, and a great love that has been with them almost all their lives. But here now they're starting to have medical problems, maybe memory problems, and when one is having trouble, it affects the other.
Sure.
And we have to be aware of these situations where a husband and wife, or they don't have to be married, but they are together, that they're starting to have problems, that we better start to recognize that, when one's going down, the other could start circling the drain also. And we need to make sure that we keep notice, because a lot of the caregivers out there, their parents, they're seeing it in their parents, and they're they're afraid for the one who's having trouble, but then the other one, it's not recognized that they're also going down with them.
This reminds me of a very interesting story. I've never forgotten this. I don't remember if I saw this on television or if I read about it, but this actually is a true story. A lot of people don't stop and think about how closely connected a couple can be that's been married for a very long time. I mean, my wife and I have been married for 47 years. Wow. But there are people out there that have been married for a lot longer than that. And then I remember in this story, the husband they could no longer be cared for in their home. So the husband, for some reason, had to go to one assisted living facility, and the wife had to go to another assisted living facility for some reason. And they were obviously very, very sad, and they hated being apart like that. And the husband one day turned up missing, and the wife turned up missing, and one of their children went back to their home, to their house where they lived before, and found both of them, and they were sitting in the front porch swing holding hands, and they were both deceased.
Mm-hmm. Yeah. And that's more common, honestly, than we think, because we've had a different situation, but where a couple passed away here in Santa Clarita about a year and a half ago. And I can't say that it was headlines, but it was, just one of these incidents where at the senior center we knew what the ongoing problems were, but, the incident itself we couldn't control.
Well, and here's what happens, and I've spoken about this before in different places here in town, but when you have a situation like that where you have a couple have been married for such a long time and one of them passes away, it's not uncommon to find people actually clinically depressed about the loss of their spouse well over a year after the passing. And that's not healthy for that person. I mean, they need help, but that's how easily that can happen.
Well, it's interesting because when you do lose a loved one, usually the time span before the extreme pain goes away is usually 2 years. After you get to a 2-year period, things, I think, seem to level out, and there's not as much sadness. People seem to move on a little bit quicker, but it usually takes a period of 2 years. But that story you were telling me, to me, that was a beautiful story.
It was.
I mean, they did what they wanted to do. They were together, holding hands in their backyard on a swing, and both dying. That's incredible.
Touching story.
It is. And if people are going to do that, I hope that's what they do.
Well, here's a little bit of good news. Older adults can be helped with the same success rate as younger people. Isn't that cool? 80%.
With their depression?
Yes, with mental health issues. That's depression, schizophrenia, any of it. 80% of older adults recovered from depression after receiving treatment that includes both psychotherapy and antidepressant medication. Now, somebody out there listening may be saying, wait a minute, I don't want to take more medication for something. Not necessarily, because a lot of times all they need to do is speak with a therapist. That's what psychotherapy is. And it does not necessarily mean you're going to need medication. There are a lot of people that are not on medication, but there are some people that need both. And if they do, if it gets you back to your normal life, hooray.
That's right. Absolutely.
And another thing I wanted to mention and we've talked about this over and over again, misdiagnosis and avoidance are common. So again, 65% of seniors think that depression is a normal part of aging, but it isn't. But what happens is if they do decide to go and see a physician, normally they're seeing their primary care physician. And primary care physicians are wonderful folks, but they're not specialists in mental health. And as Dr. Dorio knows, over 50% of the time they misdiagnose mental health issues.
Absolutely.
And when they only have 10 to 15 minutes to see the patient, and it takes 5 minutes for them to take their sweater off, you're losing a lot of time, and you're not going to make, as a primary care doctor, you're not going to make a diagnosis.
And here's another one. Only half of older adults who discuss specific mental health problems with a physician will receive any treatment at all.
Wow.
Ooh. So if you're suffering from depression out there and you're a senior citizen, be noisy about it. Don't let them tell you you're okay. If you don't feel okay, don't listen to that. Yes. And again, it's not because they're bad doctors. It's because that's not their specialty.
That's exactly right.
I mean, you come to a certain point, and your primary physician will say, I think I need to send you to a cardiologist, or I need to send you to this kind of specialist or that kind of specialist. It's actually the same thing. Yes. I need to send you to a mental health specialist. And suddenly somebody's going to go, ooh, I'm not crazy. I'm not nuts. Well, that's not what it's all about.
No, it isn't.
It's okay to have the flu. It's okay to have a cold. And it's okay to have a mental health issue.
Absolutely, because now we have doctors and therapists out there who have possibly been through that same thing. And many times that pushes them into that area of work.
But there aren't enough of them. That's our problem. And to a high degree in our society, we have pretty much failed in terms of mental health.
We have.
A lot of the homeless on the street, about a third have mental health disease.
Oh, absolutely.
And we are not dealing with them. The people in jail who are in prison, they have mental health disease. And we used to have institutes where we could patients could go, and people that could help even our seniors, but we kind of eliminated them for a long, long time, and we had no resources as doctors to refer people to.
They were called madhouses.
Yes, asylums.
Rubber rooms.
Here is some good news, because what we've done at Henry Mayo Newhall Hospital is we have set up a mental health professional in our emergency department. So if you come into our emergency department and you're having some mental health issues, you'll be seen right away. We get you mentally checked out and physically checked out as well. And so the least that if you come in, that doesn't mean that you're going to go into our behavioral health unit. You may just need some referrals, and we would be absolutely delighted to give you those referrals when you come in. We'll make sure that you and your family, if your family's with us, understand what's going on, and you get the referrals. And if you're having an acute episode, then you need to, you'll come over to our unit, and we'll take good care of you.
Boy, but I just hope that our seniors can, before they end up in the emergency room and it's something acute, that we'll have the ability in our society and all the tools that we need to be able to get our seniors to the right place and make sure it doesn't come to suicide, it doesn't come to emergency rooms, that it comes to taking care of it and getting back to your home and getting back to normal.
That's right. Absolutely. 100%. We want you to get out there and get the treatment you need before you need to come to the emergency room with it.
And some cases of depression are very, very noticeable. If family members are around, or if friends and neighbors are around, depression is very noticeable.
Yeah,
it's
interesting.
See changes in people.
I tell a story when I do presentations often about a lady who loved flowers, a senior, and she took very good care of her flowers in her house and outside of her house. And people started coming over and noticing that she was not taking care of her flowers anymore. In fact, her flowers are dying all around her. When they asked her about it, she said, "I just don't care anymore." And it took a while for her to decide that she really did need some help, because one of the things she said was, "I don't want to go to one of those nut houses. I don't want to do that."
Stigmatized.
And she was afraid that even her friends couldn't come visit her if she was in one of those places. And by the way, I'm here to tell you, yes, you can. We have visitation twice a day in the behavioral health unit in a controlled environment. It's totally safe, and people just love to have their friends and family come and visit them. It's a great thing. But by the way, this lady did get the help she needed eventually.
Wonderful. That's wonderful. And hopefully it was a neighbor who helped push her through it. Because that does happen when you have neighbors around you, and all of a sudden you don't see this person out. Wait a minute, something's wrong, and it's very obvious many times. But you have to be aware.
That's right. Yeah, you have to be able to connect those dots.
That's exactly right.
Because it's always, that Monday night quarterbacking where you say, "Ooh,
right.
if only I'd have noticed."
That's right.
So when we come back, let's talk a little bit about those connecting those dots so that we can.
I think your show's over. I don't think we're coming back.
Oh, yes, we are.
Yeah, we got
We're
a few more.
back.
Got a few more minutes.
Oh, yes.
So ... Moving forward on your hometown station, KHTS.
Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, AM.
1220.
No, KHTS. For 13 years we've been doing this.
Yeah.
And then all of a sudden we're not supposed to. It's hometown station, KHTS. There we go. And we're speaking with Mike Dougherty.
From Henry Mayo New Hall Hospital. The Behavioral Health Unit.
Thank you, Mike.
And environs thereof.
But we talked about the failure of the system, but there are parts of the system, especially at Henry Mayo, where you mentioned about the emergency room, and we have a behavioral health unit, but there is access. There are people that will help. I mean, we are far from fully organized, but I think at Henry Mayo we're doing a really good job at trying to get it organized and keep it in the realm of our seniors knowing that this is a place where they can go.
And we pay attention on the other med-surg floors in the hospital as well, because our doctor, our psychiatrist gets asked to go do consults all the time for people that are in other parts of the hospital for other reasons, and we'll often go and do a mental health consult there. And we do see patients from the hospital coming over to visit with us once they're medically stable as well. So we can take care of them for physical as well as mental. The other thing is there are places to go here in town. The Santa Clarita Valley Mental Health, of course, is located on Cinema Drive. They're there. And you can also go to see therapists in town to talk to them, groups if you need to. But, just like let's look at the Santa Clarita Valley Senior Center for a moment. You can certainly go in there and tell them, I need to talk to somebody. I'm really having some issues here.
Absolutely.
Not a problem.
Dr. Edda.
They'll take care of you.
Yep, they will.
They definitely will.
Because connecting the dots is important. So
it is, and that is another area where you can also connect the dots. If you see someone who's come in on a regular basis, then he or she doesn't come in on such a regular basis. You have someone there who's available to give them a call, go to visit them. I know Suzanne does a lot of that.
Suzanne Nelson, correct?
Yes,
right.
She's great.
And we Dr. Dorio and I, and you also, Barbara, that's right, you're a member of that as well, the Suicide Prevention Committee with Larry Shallard over at College of the Canyons. And one of the things we talk about in those meetings is the fact that we want everybody to be schooled in this, meaning Meals on Wheels, the people that deliver those, if they knew what to look for, if caregivers knew what to look for, and all of them don't with respect to that, and family members need to know. They really need to know. Maybe it will never happen, but maybe it will.
But everybody's antennae must be up because I think right now we're failing a lot in terms of moving forward on this. And, it's been the setup how government has been in the past and how, they shirked the responsibility and, placed it on community when community couldn't handle it. And then we developed all these homeless and then those who went to prison. And so it's out there and we didn't take care of it before. And I think we need to shore that up right away with our senior population and just make sure that they are okay, because statistics have shown, as you said, Mike, that statistics have shown they're at the highest level of suicide rate, and we need to attack that right now and make sure we bring that down.
They're in the greatest danger. Once they reach that magical age of 74, I guess, and on up, And isn't that sad? I mean, you'd think at that age you just want to enjoy, right?
Yeah. But, they don't. They have trouble, and we have to recognize that. And I'm thankful that here in Santa Clarita we have the ability, Mike, to be able to have people like you who are out there and putting things forward so our seniors have an understanding of where they can go and that it is available. And, Mike, thanks for being in our community. Thanks for doing what you do. I mean, it's just the hospital and putting you both together has been an asset to everybody.
Well, thank you so much. We're there to serve. That's what we're all about.
Mike Dougherty from Henry Mayo Newhall Hospital. We appreciate you being on the show. We are sponsored by Advanced Audiology and Comfort Keepers in Home Care. Listen to us next week on the Senior Hour. Now go and enhance your quality of life.